Good afternoon, Girl Scout seniors. This is Mrs. Lori, your virtual program coordinator. I'm here today to help you complete the fourth and fifth step of earning your Women's Health Badge. I've decided to combine these two steps because they both go together very well and will help you wrap up all the things that you need to be successful in earning your badge. All right, let's go ahead and get started. So just to do a quick recap, in steps 1 through 3, we started collecting quite a bit of research on how to stay healthy, how to eat properly, how to exercise properly. We explored some different cultural beauty practices, as well as focusing in on some specific women's health issues. So what we're going to do now, now that we've gathered some research, is we are going to look at a women's health issue from a global perspective. So we've looked at taking care of ourselves, we've looked at taking care of our own mental health and what other cultures find beautiful or what their beauty practices are, but we haven't taken a moment to focus on picking a topic that we want to focus on globally. And so that's why I've decided to combine the fourth and fifth steps, because step number 5 is all about sharing all of the knowledge that you've learned throughout this process in a community way, spreading it out there for your fellow Girl Scouts, to family members, to women that are in your life. And so I thought that these steps kind of worked really well together. So in step number 4, we're going to take a global look at a women's health issue. I decided to choose one that I felt obviously related very well to women, which is cervical cancer. And I decided to research that on a more global level. So I didn't want to plagiarize, so obviously I cited the website here in the link that I went to find my information. But I learned that, and by the way, before I continue with this, you are welcome to choose a women's health topic of your choice. You do not have to choose cervical cancer as your research topic. Towards the end of this presentation, I'll give you a list of ideas that you can choose from if you're a little stuck on which issue you would like to look at globally. It may be an issue that you've already taken a look at for your other steps. So in step 1, or maybe even a beauty practice that you researched in step 2, or a mental health disorder that you were researching in step 3 of this badge. You may want to choose one that you've already started researching as a part of your final presentation. But this is just an example. I learned that cervical cancer is the 4th most commonly occurring cancer in women and the 8th most commonly occurring cancer overall. There were over 500,000 new cases reported in the year 2018. Virtually all cervical cancers are associated with human papillomaviruses. We also call that HPV. However, the majority of women with HPV do not develop cervical cancer. Women become susceptible to developing cervical cancer following HPV infection. But there can be other environmental factors that can cause the cancer to develop. So then I collected some cervical cancer statistical rates globally. These were recorded in the year 2018. And this is an age standardized rate per 100,000 women. Africa seems to hold the most cases of cervical cancer. Swaziland, specifically, right here on the map, has the highest going rate of cervical cancer in the world. So, 75.3 women per 100,000 have cervical cancer or have been diagnosed with it, which is a very high rate. Then you go down through here, and most, I would say, all of these um, countries seem to lie in the continent of Africa, Kenya being the number 20 there on the list. So it got me thinking, as a, now that I've helped you along the way with this women's health badge, it got me thinking, why? Why is this so dominant in that country? And I just think it goes to show that as Girl Scouts, as Girl Scout seniors, that we should be continuing to research these issues. We should be continuing to reach out to community leaders, doing our research and, trying to come up with prevention plans. How can we get this information out into the community? So this was one that I found very interesting, and that I feel that as a Girl Scout that I am going to continue to research. Why is it so dominant um, on this continent? Why is it so dominant within these 20 countries? Why is it the most popular? So that is something that I personally will continue to research myself. Um, you definitely want to make sure that when you're researching a women's health issue globally, learning, as I stated, as a Girl Scout, prevention. It's all about getting this information out to the community. How can we prevent this from spreading? How can we take care of people around us? Cervical cancer is actually highly preventable in most Western countries because we have screening tests. We do have a vaccine that was created to prevent HPV infections. When the cervical cancer is found early, it is highly treatable and associated with long survival and a good quality of life. So as I was stating earlier, cervical cancer is brought on by the HPV infection. So we've created, or scientists have created, a vaccine for HPV. So by getting or obtaining this vaccine, it is less likely that you will get cervical cancer. That is not to say that cervical cancer isn't brought on by other environmental factors. So it got me thinking about Africa and these top 20 countries being found in the continent of Africa. And it got me thinking, do they have a lack of screening? Do they have a lack of proper vaccine care? Are they not as knowledgeable about this preventable measurement? So that's something that I think about when you're trying to go for your gold award or your bronze or your silver awards, is community outreach and thinking about these global issues and how we can be more helpful. Step 5 of this badge is all about getting the word out on a women's health topic. So you have to think back on steps 1 through 4, all of the knowledge that you were able to gather and research, and decide how you want to present this information to your community. This is the ultimate last piece in you being able to earn that women's health badge. So you're going to focus on one area that you learned about and inform the people that are in your community or the women that are in your life. Definitely, I understand that COVID-19 has put a hold on being able to meet or gather in public places. However, this is something that you can do digitally and get out there, and that will help you complete this 5th and final step. So you have 3 different options to choose from. You can design, the first one is you can design a public service announcement or presentation. So creating a digital video and posting it online for your friends, your family members, your fellow Girl Scout troop members, and you can actually tie your video into an awareness event. We have a lot of national events that occur, such as breast cancer awareness, prematurity, so premature health in babies. Lots of different national awareness events, and you could definitely tie it into that as an option. You could hold a women's health forum, so interviewing professionals. You can do this through Skype, you can do this through Zoom. It's free, easy to set up these website accounts. And then you can figure out how to present the facts and information that you learned through that interview. Last but not least, you could design a prevention program, how to prevent certain diseases or things from happening. Not everything is preventable, but if something is preventable, sharing that information with your community. Creating a preventable plan or a prevention plan for the community. Certain foods that they could eat, exercise schedules, things that people in the community or women in the community could do to lessen their chances of developing one of these women's health issues. So you could create a brochure that you give out to community members, a website, a poster display, or even a slideshow. So these are definitely your options for being able to get the word out on a health topic that you chose to research. As far as choosing a topic, here is a small list of ideas for you. There are tons out there if you go online and research. These are just a list of the most common women's health issues. So if you are looking for direction, if you need an idea of a topic, you can pause the video, take a look at this list. These are the most common women's health issues that I would highly recommend that you choose from for ultimately completing this badge. If you would like to share your projects, your final presentations, any videos, any information that you've learned, or if you have any questions, please feel free to reach out to me here at the Virginia Skyline Council. Once again, I'm Mrs. Lori. You can email me at info@gsvsc.org. Email address is right there on the screen. I would love for you to reach out to me and share your final products. I would love to celebrate with you in earning this Senior Women's Health Badge. Until we meet again, I look forward to hearing from you. If you have any questions or you want to share your projects, I look forward to doing more badges here virtually with you in the future. And I wish you the best and hope you are successful in earning your Women's Health Badge and that you learn and have fun along the way. Bye.